My name is Sydney Fournier. I'm an occupational therapy doctorate student, and as part of my capstone project, I am working to create educational videos for caregivers of infants in the NICU. In this video, I will review some stress signs you may see in your infant, what they could mean, and what you should do if you notice them. Your babies are social beings and will communicate their needs with you in various ways. Learning the stress signs can help you better communicate with your baby and recognize their needs. Stress signs are ways babies tell you that they are uncomfortable, in pain, or need a break. Each infant may use these in different order to communicate their feelings, but a general rule is the more stress signs you notice, the more unhappy baby is. So, what are the stress signs? One stress sign you may see is a finger splay or the stop sign hand signal. This is when babies hold out their hands in a stop sign motion like this, or they will extend and spread their fingers almost like they are searching or grabbing for something. Another similar stress sign you may notice is the toe splay. Similar to the finger splay, this occurs when babies spread their toes almost like their feet are being tickled, as shown in this picture. You may also notice infants searching for boundaries or extending their arms, legs, back, or neck. Searching for boundaries is common in newborn infants. It can look like baby making snow angels, flailing their arms or legs, kicking their legs, or pushing themselves into extension by arching their back or neck or straightening their arms and legs. Newborn infants come from a very enclosed environment, and now all of those uterine boundaries are gone, making them feel insecure. Therefore, when they become stressed or overwhelmed, they will search for those boundaries. Facial grimacing or furrowing of the eyebrows is another commonly overlooked stress sign, but is essential all the same, and is a way of baby telling you that they need a break. An obvious stress sign is crying. However, crying is often preceded or accompanied by many other stress signs. In babies who are intubated, crying is often silent. Therefore, it is important to watch baby during interaction and track stress signs to help them stay calm as possible. Some infants, instead of or in addition to crying, will demonstrate gaze aversion or shut down. Gaze aversion involves the infant turning away from the caregiver's face and seemingly staring off into space, kind of like this. This is a subtle stress sign and is often difficult to distinguish. However, if you are having difficulty gaining baby's attention or keeping eye contact, they may be engaging in gaze aversion. With this, you may also see baby shut down, meaning that they have little interest or response to the things happening around them or with them. This could also look like sleepiness or drowsiness. If you think baby is doing this, look for other stress signs that could help you determine if baby is truly stressed. Hiccups, sneezing, and yawning, especially if they recur repeatedly and often, are also stress signs that signify that baby could use some help calming and organizing. Fast changes in heart rate or breathing, such as heart rate dropping or rising considerably, or oxygen saturation decreasing within a short period of time, are surefire stress signs and indicate that baby is overwhelmed and in need of a break. These are significant stress signs and should be taken very seriously, as these could be dangerous for infants. If baby's vitals continue to rise or fall and do not stabilize, the infant's RN or nurse should be notified. Finally, you may notice baby's color change. This can include babies turning a bluish or purplish color, a gray or ashy color, or becoming red. These indicate that baby is stressed and should be taken seriously. Of note, the nurse should be informed if the baby continues to stay blue, purple, gray, or ashy, and has a falling heart rate or oxygen saturation. So now that you know the stress signs, what should you do if you see them? If you notice baby is becoming stressed, give them a break from what is happening. This can look like slowing movements, gently holding them close to you and still, stopping the care activity you are performing, or providing them with calming supports. Calming supports are talked about in the Calming, Positive Touch, and Bonding Techniques video. Please refer to that video to learn ways to help your baby calm and organize. If you have additional questions, please ask the nursing team or your child's therapist. We would be happy to answer them. Bye for now.